Perimenopause is a pattern, not a single lab value. I'm going to go over the different type of labs that you can get to see if you have perimenopause or not, and you can see what's right for you. If you're testing your hormones, these are what you should be looking at right here on the screen. Ask your doctor for this. And then there's 3 types of tests that you could possibly get. First off is a blood test. This is probably the most common. This is easy to get, but it's only a snapshot only. It's like a 1-day picture. And the thing is that hormones fluctuate daily. So this isn't the best way to get a whole general look at your hormonal health. This is best for thyroid, FSH, and testosterone. Second is Dutch test. This is a dried urine hormone test. This shows your hormone patterns and cortisol rhythm. This is best for perimenopause clarity if you're trying to determine if you're in perimenopause, because it shows more of a full picture of your hormones over time. It's not just one snapshot like a blood test is, not just one day. And it's more advanced, but the problem is it's not always covered by insurance. I would say most often not, it's not covered by insurance, and it's a little bit more cumbersome to do. And third is the at-home hormone trackers like Mira, and these track estrogen, LH trends, and these are great for cycle awareness, especially great if you're trying to conceive and want to know your ovulation window. They're not diagnostic, but they're very insightful and can be a nice way to give you clues that you're in perimenopause if you don't want to take a Dutch test. So that would be my second choice after a Dutch test. I think it's great if you can do all these, but it is very expensive to be a woman trying to take care of her health these days. And unfortunately, insurance doesn't cover us. So we have to take it into our own hands. And I want to do a little important piece here. Birth control does affect things. If you are on hormonal birth control, you cannot accurately test your natural estrogen or progesterone because birth control suppresses your own hormones. But you can still test your cortisol, thyroid, and nutrient level, which is also helpful, but you can't necessarily tell if you're in perimenopause by testing your hormones if you're on birth control. But hormone panels are not necessarily reliable on birth control, so just keep that in mind. So if your symptoms are loud, but your labs look fine, trust your body. Tests are not always accurate. They cannot always tell you everything because your hormones change so much day to day, month to month. Perimenopause is a transition, not a switch that flips. Remember that. And save this, send it to a friend, and follow for more hormone smart perimenopause support.